Good evening, friends and families from the global world, and I welcome my true and dear colleague, Dr. Danny Pillay, and we're going to be engaging this afternoon on a few pertinent topics. And one of the first topics we'll be discussing today is about colds and flus and how do you prevent it and how do you navigate your way to ensure that you remain healthy and more productive at work. Danny, welcome for this evening.
Good evening. Thank you for inviting me.
Danny, we've seen in the dental world recently over the last 3 weeks, lots of patients of us have had throat infections, they've had mouth ulcers, have had mild fevers, and someone's resulting in the situation we have to cancel a few appointments and ask them to get themselves attended to and ensure that they are in a better space to have treatment. So there's obviously a correlation between what we see in the mouth in terms of the inflammatory responses and the perhaps aphthous ulcer, which is stress related, and the inflammation on the throat. And how would you recommend to me as a practitioner from an oral perspective and in your experience to look for signs and symptoms?
Well, I suppose this time of the year where you have a high incidence of colds and flus, but we also have particularly interesting, since lockdown per se, we've had far more viruses, and currently there's several different viruses that we're seeing: influenza, parainfluenza, influenza A, metapneumonia, swine flu, some COVID cases. So we've got a whole, basket of organisms floating around that people can be susceptible to. I think the part is that we have to understand that there are always going to be organisms, but what must we do to prevent or protect ourselves from being infected, invaded by these organisms? Just like, if you have a healthy, well-maintained roof, when there's storms and heavy rainfall, you're not going to have a leak if you're strong. So similarly, we need to look at strengthening our body systems. Importantly, it's not to take treatments when you are sick. It's more important to have preventative healthcare strategies. So often I tell patients, you're not going to get fit on the run. So when you get the flu, taking the supplements then, yes, it's going to have some help, but you're better off taking it before you're ill. So you've already got the resource to fight an infection. So preventative healthcare is an important part in maintaining and preventing illness.
What would you recommend to young practitioners, both allopathic and people who are in the natural space, including dentists? I mean, in terms of being vigilant and in terms of recommending to patients how they may be able to prevent them and arm themselves with information, knowledge, and also the necessary medicaments.
I think first it starts with the practitioners themselves, because they're going to be primarily exposed to a lot of sick people. So for their own best interest to understand preventative healthcare. So for doctors, we would be less effort in trying to teach about hygiene strategies, the wearing of masks, washing of hands, decreasing exposure, not touching the face, the eyes frequently. So those are the basic things. But importantly is to understand taking certain supplements. For example, this time of the year, there should be vitamin C intake, vitamin D, zinc, selenium. And in my case, we use certain herbal medicines, homeopathic medicines to boost the immune system, to use things like acupuncture, moxibustion, to maintain a good immunity so that we can defend ourselves against this. And of course, to educate patients, then in turn to use the same preventative strategies. Importantly, to also discuss diets. So as we have the change of season, we should look at eating more wholesome food, more warm foods than cold foods, cold drinks. Important not to do processed food. Important not to do a lot of sugar and refined sugars. For every teaspoon of sugar we consume, there's an inverse relation to the immune system. As your sugar consumption goes up, the immune system drops. And there's enough published data around this. So it's important to eat foods that are, disease preventative, especially this time. Keeping warm, dressed warm, drinking warm liquids as opposed to having cold liquids. So we're keeping a warmer interior. that can expel any invading organism. So those are the important things. And diet, from an Indian perspective, South Indian, this is the time to have the rasam, for example, the warming food, so that you create that internal heat to expel invading organisms.
So then in terms of diet-wise, right, from a general perspective, including Western and Eastern diet, what are the principles of critical factor in diet to maintain a good immune system?
Well, the most important thing is to eat according to the seasons of your locality, meaning it's getting to winter now, we eat the kind of seasonal foods of winter here, not imported foods from another country. So if you look at winter time, your citrus fruit are out, and they're high in the vitamin C, they're high in protecting you against infections. So we've got to eat foods that are in season, and we should eat foods that are cooked. So now it's the time to give up the salads and eat warmed cooked foods. Because it's cold out there, we need to have warming foods. When it goes into the summer, warmer months, then we can do much more raw foods, cooling foods. Now you can do far more of the heavier foods, the potatoes and those who are meat eaters, eating the meat products. The warming foods are important. You can use more spice now, warming spice, or cinnamon, cardamom, clove, ginger. Those are the warming things you can add to the diet, and chili, that gives you that warmth. So that internal warmth will help you, disperse heat and cold and infections.
Danny, you mentioned about you mentioned a few aspects of foods here. How does food combinations affect your diet and immunity?
Well, especially now when you talk about food combinations, if we're doing refined foods high in refined sugars, that directly impacts immunity. Foods that are nourishing, for example, now in the colder seasons, so the ground vegetables, they will give you more energy, more fortify the immune system, that protects us. Because when it's cold, as I say, out there, we need warming foods in here. So eating that right kind of food, warm foods, temperature-wise, spice-wise, staying away from cold drinks, that kind of thing, upregulates our immune system. So if it's cold out there, we're losing a lot of vital heat to warm our body. If we add cold foods into the body, we're dropping that temperature. We require more energy to focus on digestion, less energy to expel toxins and expel infections.
So during this time of foods, what do you think should be the ratio of protein and carbohydrates and fats?
So I think the ratio should be similar as any other time, but your fat content should be around 20 to 30%. Your protein can stay 15-20%. Carbohydrates can be the rest of it with other phytonutrients, but it must come from the non-refined source. So you're having barley, having sorghum, having brown rice, black rice, carbohydrates like sweet potatoes, butternut, yams, anything that is from the ground, starches from the ground, as opposed to refined, would make far more sense, and it is far more supporting in the body's function.
Then there's a lot of people into lemon juice and lemon water, and combination with mint and coriander as a drink. They have it in the morning and somebody have it in the day. What is your take on that?
Wonderful to do those kind of things, but I insist that it must be fresh, as in plucked from the tree, as opposed to store-bought that's taken you 6 to 10 days before you get to consume it. It loses the vitamin C, so it makes sense. Fresh coriander, fresh mint, fresh ginger, fresh turmeric, with some cinnamon, clove. These are good drinks to have in the winter months, better than drinking most other warm drinks. So putting them in a flask for the day makes sense. Cayenne pepper in the person, provided you have nothing contraindicated. So, example, you don't want to take too much of lemon if you've got gout.
Yeah. So we have these young couples that husband and wife tend to work, and they have these infants at home, right? And they're infants and they have children from school. What is your advice to them in terms of colds and flu prevention in relation to diet?
So again, prepare wholesome diets. Avoid the processed food, the boxed cereals. Cook them warm meals. For example, making millet. making that with some crushed nuts, making that with some raisins, which is rich, sulfur dioxide free raisins, that iron rich to protect against the immunity, with a little bit of cinnamon, cooked with cooked fruit in there. For example, a little bit of stewed the apple or pear that will naturally stew in it. So those are kind of things we can feed the children. So it's nourishing, it's warming, and it's immunoprotective. Then also to add for the children then some vitamin C, some vitamin D, zinc, and make sure they have enough iron in their diet, because iron is protective and low iron increases your chance of getting infections. And making sure they take certain other supplements. We use some, in my practice, some formulations that we use, homeopathic and herbal, to protect the immunity, so that you can stimulate it.
Danny, there is a large discrepancy in age groups from young to old. Is there a common formula thread in terms of building immunity at all ages, or is there a variance, a difference in where the older you get or the younger you are in terms of your intake in relation to prevention of colds and flus?
Well, certainly there's an age difference in terms of dose. For example, vitamin C, vitamin D, a younger person, maybe 1000 IU. A day when an older person, higher levels. It's also got to do with, depending on the older person, if they've got other underlying diseases, chronic diseases. And we know older people are far more susceptible. We have a wicked saying in medicine that flus are God's gift to all people. Meaning that a lot of old people, when they get the flu, they quite easily can develop pneumonias, and which can cause their demise. So taking certain preventative measures in an older person is important. So if we know people, for example, have susceptibility to flus and colds, they can also be susceptible to getting shingles, for example. So using things like L-lysine and higher doses of vitamin D, zinc, selenium will be important, and other supplements that we use, herbal supplements. And if they've got underlying healthcare considerations for hypertensive or diabetes or cholesterol or their rheumatoid arthritis, so depending on the medication they're taking, then we'll individually treat them. What I prefer, from a healthcare perspective, when there's change of seasons like this, that we should be doing preventative acupuncture, moxibustion. In the old days, we were very good at change of season to do panchakarma techniques. So we're losing this kind of idea. So today we're a very reactive model. We kind of do something when we're sick. Yes. When we should be working at it, whether it's little children or adults, to work on saying, what should we do? For kids, it makes sense to do some steaming. So do some nasi and nasal cleansing. Using a little bit of Salix with a little bit of, colloidal silver, cleaning the tract, keeping the body healthy, as opposed to waiting when it's sick to react to it. By then the body's already compromised. So colloidal silver, what we can do is you put a few drops inside the Salix or one of the products. It basically, for what we do like neti pot or so. So it's colloidal silver is silver in a colloid form. So a few drops in it, because it's an antiviral, a very potent one, and antifungal. So it helps to do that. So you could use it when there's a throat infection. Other than using salt and bicarb, you can use a little colloidal silver to do a mouth gargle. So that's very important.
How does exercise play an important part in building your immunity and from a prevention perspective?
So that's an interesting question, because it's got to do with how much is good. So no exercise is bad. Too much exercise is also bad. Meaning that if you exercise within moderate limits, meaning 30 to 40 minutes an hour a day, that's okay. As long as you're eating well, that keeps your immune system quite robust. But if you do more exercise than that, what people do, ultra athletes, if you exercise too much, you actually cause immune suppression. So they become susceptible to infections. So they need to take it. So you take performance athletes, for those who are preparing, for example, at the Comrades now, if they've exercised and trained hard, they become more susceptible to infections. So they have to take more precautions of not being exposed. Washing, hygiene, taking the right kind of supplements, eating the right kind of foods becomes critical. So while exercise does give you prevention, too much of a good thing is bad.
Yes. How does breathing specifically affect your immunity?
Well, we know that proper breathing techniques decrease stress levels in the body. So decreased stress levels means there's decreased production of certain hormones. So when we're very stressed, we produce too much of adrenaline as a stress hormone. Adrenaline in turn produces a lot of cortisol in the body. So while adrenaline spikes clear within 2 to 3 minutes, they leave behind high loads of cortisol in the body. Now, high levels of cortisol directly suppress your immune system. And so low immunity then predisposes you to infections. Low immunity means when you get exposed to a virus or bacteria, you're unable to fight it off as you would if you had high immunity.
Thanks to Danny for the engagement today on colds and flus and prevention. And I look forward to engaging you with another set of topics on a bit of meditation or light therapy and a bit of yogic therapy and how that affects the body integratively and how it produces a better oral systemic health positively. And so all these kinds of things that you mentioned, and from a dental perspective or oral health physician, I think it's very relevant what you said initially. The practitioner needs to practice in order to give the correct advice to the patients. If you live the talk and you're able to practice it and engage with the patient more proactively. Thank you very much.
Indeed, remember, prevention is better than cure. It's an old adage, but a very appropriate and long-lasting one.